here with Phil Johnson, the Manager of Community Services and Systems Change for TAIBU Community Health Centre. How are you today?
I'm good, thanks, Hillary. Thanks for asking.
Of course. Could you please tell me about TAIBU Community Health Centre, your services, and the community that you serve there?
Yeah, so TAIBU is a community health center that was established here in the Malvern area of Scarborough in 2008. So we've been around for a relatively short space of time compared to other CHCs. We're one of about 100 plus CHCs across the province. And like all CHCs, or most CHCs across the province, we have a community-based mandate. So we serve the local community of Malvern and North Scarborough. But TAIBU has the additional mandate of serving the Black population across the GTA. And that comes with unique challenges and opportunities. As you know, the Black population is quite diverse. And so we are tasked with serving that complete diversity right across the GTA. You know, the GTA is a very, very large area, so extending from Durham in the east, York in the north, and Peel and Halton in the west. So large population, but you know, we're offering our full range of primary healthcare services. So doctors and their allies, and then we also have our community programs that serve everybody. And I like to use the term from cradle to grave because we serve, you know, everybody who's in our community.
Awesome. So as you just described, TAIBU Community Health Centre is focused on, serving, developing best practices and advocating for policies that improve the health and quality of life for racialized groups. Do you see particular areas where increased federal investment in community health centers would enable you to increase your reach at TAIBU and improve services overall?
Yeah, there's definitely opportunity. So, I mean, one of the things that we've seen in recent years is that the government has come to the table with funding specifically for Black healthcare issues. And so we're thankful for that. But a lot of that funding is project-based funding. And so what we would like to see is more core funding. So a funding that's sustainable so that we know that these programs won't be running for a short time, but they'll be running in perpetuity or at least as long as they're needed. So here at TAIBU, we have a number of those project-based programs that we're currently running. And, you know, they're very important programs. They're doing good work. There'll be proof of efficacy as those programs play out that will allow us to be able to share, you know, right across the board, findings, results, resources, stories, etc., with other CHCs, other community organizations, other community members. And so, you know, we're very proud of the work that we're currently doing and look forward to how a lot of that work plays out. But as I say, with that work, when that project's done, if there's no additional funding that we can secure, it becomes hard then to sustain some of that work. And so, as much as we're, you know, as I say, we're thrilled to have these projects, we want to see the government really come to the table with core funding to sustain research into Black communities, but then also making sure that we're able to sustain the full spectrum of health. And we know that there's a, you know, disproportionate health impacts on Black folks across the country, and so having that core funding would be important to helping not only TAIBU but other community health centers and other health institutions across the country address very specifically some of those issues that we know the Black community face. And those issues are numerous, from, you know, increased sickle cell disease, heart disease, diabetes, all those things. And we know that, you know, those things also affect other communities. But in terms of health access for Black folks, we know that can be very, very difficult in terms of, you know, presenting at a hospital with sickle cell symptoms and being turned away because, you know, hospitals don't understand some of the issues that people who have sickle cell disease face.
What is the current situation in Ontario in terms of access to community health centres? And I know that Ontario has a large amount, but why would you say there is a need for more community health centres in the province?
Yeah, community health centers do frontline work in ways that other organizations can't. So hospitals can't do the work the way that we do it, and other healthcare providers can't do the work the way that we do it. We offer a fully integrated healthcare solution. So as I say, we have not only our primary care physicians, but we have nurses on staff. We have chiropractors on staff. We have foot care specialists on staff. So we got a full range of services that we can offer for members of our community. And then we also have our community programs. So our community programs are really, again, offering people in our community the ability to access services and support. So everything from a mental health support group through to physical fitness exercise programs. And our programs come with all the amenities that people would need to be able to participate. So, for example, when we go back to in-person programming, hopefully at some time in the not too distant future, we offer childcare so that folks who are participating in our program can bring the kids, put them, with our childcare, our childminders, and be confident as they go off and do some sort of any kind of programming. Whether again, it's a mental health workshop, or a physical exercise workshop as well. And so the need for that kind of integration is very important across the province. And when we think about offering those kinds of services are needed by everybody. It doesn't matter if you are, a new immigrant or somebody who is part of what we call working poor or what have you. Everybody who is a member of our community needs access to these kinds of services. And so having them delivered in the model of community health care, I think is a real service to our local communities. And as I mentioned earlier, there's 101 or so community health centers right across the province, and that sounds like a lot. But we need to get more community health centers in more communities, and having more population-based health centers as well. So they say TAIBU is one community center serving a vast number of people right across the GTA. If we had more TAIBUs, then our burden would be lessened, and we'd be able to deliver much more services to a broader number of people.
Awesome. I want to thank you so much for your time today.
Hillary, it was my pleasure, and I'm glad to have done it.